I would like to say a few words about what Psyon does, because we are one of the first innovators in this area in the Czech Republic. And I would like to talk about one of our novel treatments that we have been doing for about 5 years. So briefly about Psyon. Because we are engaged in novel treatment, but especially in healthcare, we need to build on quality and meaningful foundations. We can't just add new therapies and ignore those who have been working well. Therefore, we are providing standard psychiatric, clinical, psychological and psychotherapeutic care for hundreds of patients every month. For them, such treatment is perfectly adequate. At the same time, we believe that we need to educate more experts and raise their qualifications, and that's why we train younger colleagues. But we also believe that life is one huge shifting area. That's why we have to be innovative, and that's why we are trying to carry out our own studies and research. And we have been aware for a long time of the fact that the efficiency of some existing tools is limited, and that's why we're the first to Europe to implement ketamine-assisted therapy. And about 1,000 patients have already received this treatment. I would like to show you some data which we have collected. You can see 2 charts. On the left, you can see depressive symptoms. A week after the conclusion of the therapy, and be it depression or PTSD or generalized anxiety disorders, a week after the conclusion of the therapy, we can see a significant drop. The first dot shows where the patients come to us with medium serious depression, and following the treatment, they even leave the spectrum of low depression. And that happens within a few days, and that's clinically very beneficial. And what's also interesting when you look at both charts is that the therapy is durable in time. You can see 1 month, 3 months, or 6 months after treatment. It's still the same. It's still efficient. The figures are also interesting. You can see that the first point was for about 1,000 patients, the last one about 500 patients. Those are really high figures. We are not aware of any other study in the Czech Republic which would have been done using real patients and real figures. And also the figures below are interesting. We can see 0.05 to 0.07. That's the degree of efficiency. We know that in psychotherapy, it's 0.3 to 0.5. That's the effect size. And here we can see that it's 0.5 to 0.7. And that's because we work with a sample of people for whom current therapies are not efficient. Therefore, there is a much bigger potential with this type of therapy. It's this efficient. And we can also see through anecdotal secondary data that our patients really experience a return to life. The degree of their invalidity goes down, the quality of their life goes up. And it's also important to note that such a big sample shows that the therapy is well implemented in the healthcare. It is possible to implement it well, and it's also safe, and it's well tolerated. And if I were to sum it up, these are data which show that there is another piece of the palette which is efficient and durable. The symptoms not only go down, but the quality of life goes up. And it's efficient also for treatment-resistant patients. We have been using this therapy for a long time now. We can see that hospitals, outpatients, and other doctors have started implementing this as well. It's undergoing a sort of renaissance. Thank you very much.